Dr. Corbin Partridge was the chief of head and neck surgery team for 47th Combat Support Hospital in Iraq from 2005 to 2007. After Dr. Partridge's service, he was awarded 2 Meritorious Service Medals, the Army Commendation Medal, and 2 National Defense Medals. He also was awarded an Iraq Campaign Medal, a Global War on Terrorism, an Expeditionary Medal, and other ribbons.
When I was a child, I always looked up to my grandfather, who was a company commander in World War II and was awarded 2 Silver Stars, which is the 3rd highest honor to be awarded in the military. And then I've always had my grandfathers and cousins who have served, and so is honestly following in their footsteps. And so I served in the National Guard as what's called an enlisted, which would be like a sergeant. So I went that route, and then through the military, paying for my school, I ended up becoming an officer. I originally started out as a combat engineer in the National Guard, and I served as a combat engineer to being what's called an E5, or a sergeant in the United States Army. Then when I went to school, I joined the Health Professions program, which is a direct commission to becoming an officer. And so the majority of my active service was serving at Fort Stewart, Georgia, in support of the 3rd Infantry Division, which is the division that actually liberated Iraq when they first made that push in. And a year of that service when I was in Georgia was actually with the 47th Combat Support Hospital. A total of 12 years. So serving in Mosul, Iraq with the 47th Combat Support Hospital, we were located on it's called a forward operating base Diamondback, which was a large area, and we were right on the airfield, so the helicopters and planes could bring patients or people could fly out. The day-to-day activities were such that as doctors, I personally was assigned to work with patients who were sick on the ward, plus associated with the trauma team, as well as my own duties, which was the maxillofacial or facial trauma in the surgical airways.
Dr. Partridge, as a maxillofacial surgeon, repaired trauma to soldiers' necks and heads. The Combat Support Hospital in Mosul, Iraq, was a medical unit staffed with physicians, medics, and nurses, all to aid trauma victims.
So in the mornings we would all meet, there'd be 15 to 20 doctors and the anesthesiologists, and we would round on every patient as a team. And then once we were done with that, we would finish our daily activities, such as treating, the patients who were sick or wounded. And when that was done, in between times, we would generally actually go to the fitness center and work out. And you had to get into a routine, actually, to make the days go by. And sometimes it felt like it was a Groundhog Day. There's a big sign where I was deployed that said, "Welcome to Groundhog Day," and honestly, that's what it felt sometimes, because the days were very the same. Doing rounds, which means treating patients, working out, eating at the same time, and then always being ready for the casualties to come in, which sometimes we'd see patients. I think our record casualty was 33 at a time that were brought in from an airfield, from an explosion where they blew up a police station in an airfield. And so we brought in 33 patients, some who died, others that were just generally wounded, but the majority were surgical patients. So we always had to be ready for that. So I honestly never had any preconceived ideas about the war. I think the ideas I had about the war, in my mind, I always, as a child, felt as if I would serve in a combat zone. So my preconceived ideas about war was just the brutality of it, and the people who die and give their life for something, a good cause. When we first arrived in Mosul, it was just the unknown, what was going to happen. It's very, you just feel indestructible, like nothing can happen to you. Towards the end, as you got closer, you've been serving all this time, and the days get closer. It seemed like the mortar rounds or the bombs these guys would send in, because they try to, they want to hit the hospital, that would be their goal. They would seem to get closer, and it's probably because you've been there for so long, and you can see the days coming to an end, and you want to get home to see your family, your children, and your wife. In fact, at the end, there was a mass casualty where we actually treated our own hospital staff because the mortars hit so close. A lot of our staff took rounds to the bellies. And so 3 patients actually underwent surgery that was like medics from our own hospital. We didn't interact a lot. They're very quiet. They don't say a lot. The women especially are very I shouldn't say standoffish, but that's the way they come across because they're taught not to really interact with men. The way you say hello is you put your hand over your heart. You never point with your left hand because that would mean something dirty. You never make a motion towards your feet. But overall, they're very, the people that we saw were very generous in terms of being very thankful. In fact, we treated the governor of the province where we're at in Mosul, and they actually brought in just a whole spill of food. It was amazing, the food they brought in. You know, I always thought war would be the gruesome effects, the blood. You know, I always say that we didn't go to the war, but the war definitely came to us as a combat hospital. In other words, on a daily basis, we saw the consequences of war. I guess it's what surprised me the most was that first death I saw, and the camaraderie these units had when one of their soldiers died. And as the Stryker come through, which is a big mechanized vehicle, brought these people in, and he got hit by a sniper in the head, and then I remember the big sergeant carrying this private in, this African-American private, just carrying him in tears. And I just thought to myself, what love they have for each other. They may hate each other, honestly, because they're living with each other, but they just love each other. It's like a big family. So just the brutality of it and how these soldiers just bonded and loved each other and how they took care of each other. It's just very hard sometimes to get me rattled. So people always get, they have a hard time after war. For me, I felt like it was a very good experience. The medals you receive are they're awarded to you. You know, somebody might say you won this or that, but they're just awarded to you. And the medals really don't mean much to me. It's more what the family feeling that you had with the people you served and lived with on a daily basis. And honestly, just the biggest award I had was when I walked off the plane and saw my wife and got a hug. Honestly, that's probably the biggest award I ever got. I think the military is a fabulous way of life. I miss it a lot. In fact, if my son came to me and said, "Dad, I want to go to West Point, the Air Force Academy, the Naval Academy," I'd probably be the proudest dad ever. The people who serve in the military that I experienced, there's bad people everywhere you go, but the majority of people who serve in the military are they honestly can be salt to be with.
Thank you for your time. Dr. Partridge now practices as an associate to Dr. Brent Garrison of Northeast Oral and Maxillofacial Surgery of Indianapolis and resides with his family in Fishers.